aim to ensure the latest health innovations are reaching those communities that need them most. Only together can we get through this pandemic in national unity and global solidarity. I repeat, only together can we get through this pandemic in national unity and global solidarity. Thank you.
One of 6 UN languages plus Portuguese.
Nurses Day, and last week we had a statement from the International Council of Nurses that 90,000 nurses or health workers have been infected and 260 have died. Do you have accurate statistics on this, and can you comment on it, please?
Thank you for this very, very important question. So healthcare workers who are on the front lines of caring for patients and caring for our loved ones who are infected with COVID-19 are a priority to ensure that they stay healthy. We are working with our infection prevention and control specialists across the world to ensure that the guidance that we have out ensures that they are protected when caring for patients. We are looking at the number of healthcare worker infections that have been reported globally, and there is an alarming number of healthcare worker infections. And in some countries, upwards of 10% of the reported cases are among healthcare workers. What we've done and what we are continuing to do is to better understand where healthcare workers are getting infected, why healthcare workers are getting infected, and how can we ensure that this is reduced and this stops. What we understand from the studies that are being reported and from our teleconferences that we are having with clinicians and with infection control specialists is that many healthcare workers have had contact with a known case that is among a family member, which indicates that many of them have been infected outside of a healthcare facility. Some healthcare workers are getting infected inside the healthcare worker facilities, and the studies that are coming out are giving us a clearer picture of why this may be. First is that early on in the pandemic and early on in countries where they're starting to see initial cases, many of those cases are identified in wards that aren't used to infectious diseases. They're not used to respiratory infectious diseases. And in many of those wards, long-term care living facilities or geriatric wards, they're not wearing personal protective equipment, protecting against respiratory droplets. Once a COVID patient is identified and the appropriate PPE is used, then we can prevent transmission. The other reasons why we're seeing healthcare worker infections are extended periods in wards where individuals are working very long shifts. In some situations, they have not had adequate PPE, which includes masks, goggles, face shields, gowns, gloves. In some hospitals, there has been reports of suboptimal hand hygiene. So making sure that healthcare workers use hand hygiene is very, very important. What we do also see from these studies is that when healthcare workers do wear appropriate PPE, which includes protecting against respiratory droplets and contact transmission, and in situations where aerosol generating procedures are conducted and there's airborne precautions are necessary, we're not seeing that transmission take place. So that is really critical. But we are constantly looking at the literature that is coming out to better understand how we can better protect healthcare workers. We can ensure that their shifts are shorter, that they have adequate rest periods, that we look out for their mental health and their well-being, and that they have adequate supplies of personal protective equipment.
Healthcare worker, I mean, we sometimes imagine that's healthcare workers working in very sophisticated tertiary facilities. A lot of healthcare workers have been affected in the front lines in long-term care facilities as well, and in primary healthcare to general practitioners and others. So the protecting workers who work in COVID-19 isolation units and intensive care can work extremely well if they have the right equipment and training. But we also have to look at the risk management for those other frontline workers who may come into contact with COVID-19 cases to ensure that they're adequately protected too. So it's a complex issue, and the definition of health worker in this case is very broad.